In the first video of the series about the anatomy of the upper limb, we will be dealing with the bones of the upper limb. Before anything else, we should review the divisions of the upper limb. Essentially, we can divide the upper limb into two parts, the pectoral girdle and the free upper limb. The pectoral girdle of the upper limb is called the cingulum membri superioris or cingulum membri pectorale. These two terms are equivalent to each other. The free upper limb is called the pars libera membri superioris. These regions are made up of different bones, both the free upper limb and the pectoral girdle of the upper limb. And different bones form them. The pectoral girdle of the upper limb consists of two bones, the clavicle, that is the collarbone, and the scapula, that is the shoulder blade. The free upper limb is made up of more bones, many more than the girdle, which is why, to make classification easier, we can further divide the free upper limb into three parts. The most proximal part, that is, the one closest to the trunk, is the brachium, or arm, the antebrachium, or forearm, and the manus, that is the hand. And it is important to emphasize here that the hand is not synonymous with the upper limb, even though in everyday language and for lay people, this is much more common. Here, you should keep in mind that when we put on a glove, we actually pull it onto our hand, and that shows where the hand ends. This makes it easier to remember and not to confuse things during anatomy colloquiums or exams. So, when looking at the bones of the free upper limb, we can say that the brachium is made up of a single bone, a long tubular bone called the upper arm bone or humerus. The forearm consists of two bones, the ulna, which is positioned more medially, that is, closer to the midline, and the radius, which is positioned more laterally. In Hungarian, the radius is called the orsoxont, and the ulna is called the synxont. The manus, that is the hand, is made up of many bones, and the terminology and detailed anatomical description of these will be discussed later. First of all, as a broader classification, it helps us to know that we can distinguish three types of bones here. The most proximally located are the bones of the wrist, bones, which we call the ossa carpi, the bones in the middle of the hand, the ossa metacarpi, and the phalanges, that is, the finger bones. The first bone of the upper limb girdle that we will examine is the clavicle. The clavicle is also a central bone in the sense that it is the only bone that actually attaches the free upper limb to the trunk, specifically by connecting to the sternum, thereby creating a link with it, a joint. First of all, what we need to examine in the case of the clavicle, that is the collarbone, are its surfaces and its individual parts. Overall, we can say that the clavicle can be divided into three main parts from this perspective. There is a part that serves for articulation with the breastbone, and there is a part that serves for articulation with the scapula. The surface that serves for articulation with the breastbone, that is the sternum, is called the articular surface of the extremitas sternalis, which we will refer to as facies articularis sternalis, since it is clear that this is the part closest to the sternum, that is the breastbone. The name of the other end, the other part, requires a bit of explanation because the scapula has a part to foreshadow a bit that is called a process, the acromion. This is the acromion, and the surface that serves for articulation with the acromion, as you can see, is named accordingly. So this is the extremitas acromialis, and on its most lateral part there is an articular surface, which we call the facies articularis acromialis, which serves for articulation with the acromion. In addition to all this, we can also distinguish a third major part on it, the corpus clavicular, which is essentially the body of the clavicle. If we look at the clavicle, at first glance, you can tell that this is a flat bone, a flattened bone, which, if you really want to interpret it from above, would be S-shaped, and you can see that on its upper surface there are not really any structures, whereas on the lower surface there are numerous structures, which are caused either by ligaments or by the origin of a muscle. I will describe these from the medial direction moving laterally, and the first one is for a ligament. Well, ligaments don't usually attach either, but it's simpler to say that it serves as an attachment or origin for a ligament, namely, this is where the so-called costoclavicular ligament starts. It's called the costoclavicular ligament because the Latin name for the rib is costa, and it connects the clavicle to the costal cartilage of the first rib, thereby stabilizing the position of the clavicle. Accordingly, there is an impression here, a roughly finger-sized indentation on this area of the clavicle, which we call the impression for the costoclavicular ligament. Impression for the costoclavicular ligament, so this is found on the medial part of the clavicle, specifically on its inferior surface. The next structure is caused by a muscle, namely the subclavius muscle, which, as you can see, also attaches the clavicle itself to the first rib, and the corresponding area can also be found on the inferior surface of the clavicle, which is called what we call the sulcus for the subclavius muscle, or sulcus musculi subclavii. So this groove serves as the origin for the subclavius muscle, the sulcus musculi subclavi. If we move laterally, we can find a more posterior, medially located bump, and a more lateral, anteriorly positioned groove. The more lateral or more medial posterior bump is called the conoid tubercle, or tuberculum conoideum, and the anterior and the more laterally positioned groove or line is called the trapezoid line, or linea trapezoidea. These are characteristic and important because from both the conoid tubercle and the trapezoid line, there are ligaments that extend to the coracoid process of the scapula, that is, to the coracoid projection. This is also reflected in their names. From the conoid tubercle extends the conoid ligament, or ligamentum conoideum, and from the trapezoid line extends the trapezoid ligament, or ligamentum trapezoideum.